course was excellent. The course started off with a day of didactic learning, which kind of really outlined the fundamentals on what you have to do to, or what you really should be looking for in case selection. If you are a beginner, you get a 10-point checklist that really kind of keeps you in a good comfort zone, kind of, hey, these are cases I should be doing, and really knowing when to refer and when to keep is really going to keep you, you're not going to get in any trouble that way, so you're going to stay on that path to keep developing your implant skills, as opposed to having a bad experience the first time out, and then you say, well, I can't do implants, I'm done, I'm not going to do it anymore. The 10-point checklist that he gives you really kind of keeps you in a good, safe area, or safe case selection as far as implants goes. So that was really great. And then basically knowing when to do things is really half the battle. The mechanical, or actually just the procedure part, is not that difficult. It's knowing when to do the certain techniques that's important, and the didactic gives you that.
So what do you think about the live surgical portion aspect?
The live surgical portion was excellent. There's no substitute for live surgery. There is not. Mannequins don't. It doesn't matter. You can't. Cadavers, mannequins, whatever you want to call it. It does not matter, because you don't have that. I guess fear is the right word. You don't have that. If I screw up, this is a real person with those things. So you don't pay as much attention, or you don't have that kind of feeling that you're going to have in your office when you're actually doing it on a patient. You need that immediate. You need that working on a live patient to really get the sense of what you're actually going to be doing in the office. Whereas a cadaver and a mannequin, although they are very good and they help,
right, they're
not going to give you. The simulation will never be as good as the real thing. You're never going to encounter the variables in a cadaver or a mannequin that you will in real life with.
So you're an endodontist. So what do you, from that perspective, what do you think? What was your experience relative to, obviously you're endo, but you do a lot of surgery and everything else. Relative to implants, what do you think?
As far as, I think, from an endodontist, I think it's where the specialty, I think that's where the specialty is headed. It's an aspect of the specialty that one of the lectures I saw was that endodontists started implants. They were the first people to use what they would do on anterior teeth. They would just make the apex huge, and then you stick an implant right through the apex, and that would keep the tooth there. That's the first implants that were done by endo, and I obviously stopped doing it. But cool. That's kind of how it started. But from an endodontist, I can offer 3 procedures now. From that position, there's no bias. You go to an oral surgeon, all they're going to offer you is extract an implant. But whereas if you go to a general dentist who can do apicos, or you go to an endodontist, it's, hey, if there's a bad tooth, I can do a root canal, I can do an apico, or I can do an implant now. So that's kind of where it comes from me. As far as the quality of the course, it was excellent. It's supplemented. I learned some stuff that I can apply to my endo surgery, just with the suture tying, different techniques that way. But yeah, I got to learn a whole lot of different things, even just from a grafting standpoint as well. It was very good.
Instructors?
Excellent instructors. They're high quality guys, real down to earth. Definitely not condescending in any way. They're very eager to help, and very understanding and patient with you. And they're very good about letting you do the work. They didn't really say, okay, hold on, I got to take over here.
Let me jump in.
They didn't really jump in. It was very, hey, I'll let you stumble a little bit,
right, within
reason. You're not going to let you hurt the patient either, but you have to kind of learn a little bit before you can really, and a good instructor will let you go, as opposed to just jumping in and say, hey, watch this, because you really only learn when you do the thing, not when you watch it.
Excellent. Thank you, man. I sure appreciate it.
No problem.